Welcome back to our series on chronic venous disease. Today we'll focus on the indications for endovenous treatment based on the latest guidelines. After evaluation and sonography along with compression and pharmacological treatments, it's crucial to understand when to perform endovenous treatments. The guidelines strongly recommend endovenous ablation or high ligation and stripping for treating symptomatic axial reflux in GSV or SSV. However, the recommendation is less strong for the anterior or posterior grade saphenous veins with or without phlebectomy if needed. For truncal veins, the size alone isn't a deciding factor for ablation. It's the reflux time that matters. If only the SFJ is incompetent, don't ablate the competent GSV trunk. On the other hand, if the SFJ is competent but the GSV trunk is incompetent, then ablate the GSV trunk. When an incompetent segment is between two competent valves, phlebectomy is the preferred treatment. For below the knee reflux in GSV, only ablate the below the knee point of GSV. If there is above the knee reflux with a competent below the knee segment, ablate both segments. For very superficial GSVs, especially in slim patients with less than 5 mm distance to the skin, consider a non-thermal mode of ablation. In these cases, mini phlebectomy or limited stripping is safe as non-thermal ablation can also cause induration. In patients with C2 disease, treat the superficial incompetence first, even when there is concurrent iliac or iliofemoral venous obstruction. For tributaries, intervention is typically performed on those larger than 5 mm in diameter and more than 500 milliseconds of reflux. Treat tributaries in the GSV, SSV anterior posterior saphenous vein with phlebectomy or ultrasound-guided foam sclerotherapy. For treating tributaries, guideline giving more weight to the GSV and SSV. Whether to stage or perform treatments concomitantly depends on the patients and physician. If staging is planned, wait at least 3 months in between. While endovenous thermal and non-thermal ablation have largely replaced open surgery, ligation strategy can still be applied when endovenous equipment or expertise is unavailable. Thank you for watching. If you found this video helpful, please like, subscribe, and stay tuned for more insight on managing chronic venous disease.